Hi there, in this video I would like to show you how to help patients that have a dental insurance that we don't take or patients that don't have dental insurance. As you probably know, our office participates with some of the PPO insurance plans, but not all of them. We also don't participate with HMOs or medical. However, we do get calls for patients that have dental plans that we don't participate in. One fact that is important to remember is that our mission as healthcare providers is to help the person no matter what their insurance status is. First, we need to determine how important it is to the patient that we participate in their plan. It can be challenging to help patients that call or come to the office with their insurance as a priority. Since we would like to help the patient, we will try not to start the conversation with a negative statement. For example, if they ask, "Do you take ACME insurance?" and you know for a fact that we don't participate, you will not say, "We don't take it." Because in most cases, that would be the end of the conversation. The patient will respond, "Okay, bye," and just hang up. From their point of view, if we don't take their plan, we can't help them. And nothing could be further from the truth. So when the patient asks if we take their insurance, you can say something like, "With ACME Insurance, we participate as an out-of-network provider. One great feature of your insurance plan is that you can choose to go to any dentist you like and they will reimburse for services. Now, when you choose an out-of-network office like ours, your co-payments are a little higher to compensate for the quality and time that we dedicate to each patient." And then you ask him, "Did somebody happen to take the time to explain to you how your insurance benefits work?" Which usually the response is, "Not really." Well, if you like, we can schedule a complimentary consultation. We can have our treatment coordinators sit with you and explain how your plan works in our office. And if you decide, you can stay and do your treatment with us. So at this point, we're trying to encourage them to keep communicating, because believe it or not, some patients don't mind having higher copays as long as they get great quality of treatment. Fortunately, not everyone is motivated by insurance, and some people understand that their insurance only helps to a certain degree. Now, it's very important that it's absolutely clear to them what it means to choose an out-of-network office. So if at any point they seem confused or they're still asking, "So do you take my insurance or not?" we have to tell them straight, "We don't participate with that specific plan, but that doesn't mean that you can't come to our office. Your benefits are going to be distributed differently than if you go to an office that takes your insurance." Insurance can be a very confusing subject, even for those of us who have been working with them for several years. So it helps if you can explain it to them with an example. So here's what happens when you get an exam and a cleaning at our office versus an office that is in network. Or here's what happens if you get some treatment like fillings in our office versus an office that is in network. Since the information that patients get from insurance reps or from human resources is very limited, and in many cases they're given the wrong information, it's our responsibility to understand and re-educate patients on the difference between in-network and out-of-network. Now, why would someone decide to go to an out-of-network dentist when they have lower co-payments at an in-network dental office? Well, like I said, not everyone is motivated by money, and I can speak for other dental offices, but in our office, with some plans, we're not able to participate as in-network because that would mean limiting the treatment options that we can offer to our patients to whatever the insurance covers. And in many cases, what the insurance covers is not what is in the best interest for the patient. I wouldn't recommend a bridge to replace a missing tooth just because the insurance doesn't cover implants. Also, because we're not limited by insurance, we can dedicate as much time and resources as we need to our patients. That means that I can choose to work with the best labs and the best materials instead of having to look for the cheapest option. So you can explain to patients that yes, they will have higher copays, but they can be sure that they will get the best quality of care. Sure, not every patient will agree with having to pay more, and that's okay. We want to be able to help those who can see the value in better service. So make yourself familiar with the plans that we don't participate or that we're not in network, And if you're not sure, get the contact information of the patient so you can do some research and then you can call them back once you have the right information. And last, because this is new information, it can help to role play this type of exchange with another team member so you can deliver this communication more effectively. I hope this helps, and I'll see you in the next video.